Bonsoir. Good evening. I'm Vanessa Carey, and it's my pleasure to welcome you this evening to our session on the importance and the power of healthcare workers in this moment that we face today in COVID-19. And as you know, this pandemic that we're living in today is unprecedented, and it has thrust healthcare workers into a global spotlight. And I'm a physician, so I say we've been essential to the pandemic response in terms of being able to ensure that we can care for our patients. But equally, we have needed protection, we've needed support, we've needed the ability to be empowered to respond in this moment. And too often we've seen that healthcare workers have not had that kind of protection. So nurses, physicians, midwives, community healthcare workers, home caregivers, all of us also are added to the additional stress that often many of us are migrants, many of us are women. And so we have additional aspects of inequality that we must encounter, or abuse even. So we're facing a time where countries scramble to train and replenish their healthcare workforce. We really do have a new opportunity for global cooperation, regional cooperation, and community cooperation to help respond to this moment in this pandemic. And really to understand and to invest in the power of the healthcare workforce. I run an organization called STEAM Global Health that partners with governments in sub-Saharan Africa to build healthcare capacity. Seeing healthcare workers and healthcare professionals as the backbone of the health system and essential to any health response we try to counter, whether it is COVID, whether it is a woman delivering, whether it is non-communicable disease, or whether it is addressing social determinants of health. And so for me, it's a great pleasure to moderate this session and also to welcome our very esteemed panelists who will be joining us today to talk about some of these things. It's my pleasure to introduce to you Dr. Alex Soros, who's the Deputy Chair of the Global Board for the Open Society Foundations. He sits also on the board of Bard College, Bethlehem Jewish Action, and Central European University. He has written a number of key pieces that include the New York Times, the Guardian, New York Daily News, Reuters, the Miami Herald, and other high-profile journals, pushing us to think and to challenge how we are engaged in the world. Ambassador Roman Macayanes is the executive president of the Costa Rican Social Security Fund. He's a Costa Rican entrepreneur, biochemist, and politician, rather extraordinary combination. And he's been known for his adamant opposition to the Dominican Republic's Central American Free Trade Agreement, and later for his work as executive vice president of the Costa Rican Social Security Fund during the 2020 coronavirus pandemic. He currently is the executive president of the board of directors of the Costa Rican Social Security Fund, as I just mentioned, and has been really on the front lines of how the country is responding to COVID at this moment. Dr. Susanne Jacob is the regional director of Europe for the WHO and has been in this role for about a decade now. Originally from Hungary, she's held a number of high-profile national and international public health policy positions. And before her election to regional director, she served as the founding director of the European Union, European Center for Disease Prevention and Control. Dr. Svein Mofoke is the UN Special Rapporteur on the right for everyone to enjoy the highest, basically specifically on the right for everyone to enjoy the highest attainable standard of physical and mental health. She's currently a commissioner for the Commission for Gender Equality in South Africa, and is a member of boards of the Safe Abortion Action Fund, the Global Advisory Board for Sexual Health and Wellbeing, Accountability International, and she uses her areas of focus specifically to address issues of gender equality policy, maternal and neonatal health, universal health access, post-violence care. And so all of these panelists represent different viewpoints and critical perspectives on how we empower our global health workforce to address the pandemics of today, the pandemics of tomorrow, and to build it to a place where we can use health as a mechanism for well-being. So I'd like to open really asking all of our panelists the same question that I want each of your perspectives, and I'll ask Dr. Soros to go first. But the plight of healthcare workers has received unprecedented global attention due to the pandemic. But it seems that little has actually changed, despite this rhetoric, to actually support these essential healthcare workers. And despite the clear challenges we have seen at present in this moment, 8 months down the line, and the problems of receiving COVID, where is there signs of hope for change? What does need to be done?
I think I'm up. Hi. Can you all hear me? Does the sound work? Okay, good. We're having some issues earlier. First of all, even though I have a doctor in front of my name, it's not for anything revolving medicine or public health. The only thing I think I can prescribe is mythology. I'm sorry to disappoint you all, but on the issue of the public health workforce, which we at OSF take very seriously. I think globally, obviously the attention to the pandemic is going to be the defining moment for the lives of many young people, and I sure hope that will be a catalyst for public health and the workforce to be taken, the health workforce to be taken more seriously. Across the world. Certainly, if I were, going into university today, I'd probably study epidemiology and not history. With that said, I think we've seen a lot of great symbolism and solidarity with the health workforce, and I would include domestic workers in that. But as we've seen, as I sit here in New York City, and we saw how long it took for 9/11 first responders to get their, to get what they were owed. I think we're going to need more than just, symbolic gestures, but real concrete action in policy change to help the workforce and first responders. Thank you.
My audio is a little bit better now. Dr. Mofokeng.
Yes, well, first of all, thank you very much, Dr. Carey, for introducing the panel. It's a real honor to be with this very select group talking about a very important issue, which is the plight of our first responders, our healthcare workers. And I think there are encouraging signs. First of all, in this pandemic, healthcare workers are heroes. And that sets a mindset that allows for a lot of things to happen at a national level, and also for policies that are designed to support these people that are in the front line, risking their lives and taking care of the rest of us. I'll talk from a perspective of Costa Rica, which is what I've been viewing and participating in as a healthcare director. The country has responded with an all-of-country response, and that is that we don't just leave things to the hospital, but this has to start in the community, because if we think we're going to stop a pandemic at the hospital, that's a failed approach. There won't be enough resources, human, material, beds, and so forth to be able to respond to the pandemic. And so this was clear very early on, and we had a response that was a very sort of solidarity response from the entire country. For example, chronic patients have to pick up their medications periodically. for their diabetes or hypertension and so forth. And these are precisely the people at the highest risk of complications from COVID. And so what was implemented early on was a distribution of medications to everyone's home free of charge. And this was done with a massive effort of volunteer drivers that really took hold, and it involved public institutions, private companies, citizens, and so forth. And we kept a lot of these higher risk groups at home protected, and therefore minimized the amount of people that were showing up at our hospitals. We also had a very broad support for our healthcare workers. It wasn't unusual for citizens to bring meals to hospitals, to give to healthcare workers in appreciation for what they were doing. We had policemen showing up in caravans with sirens and all, just to honor our healthcare workers. Even serenades from our police force to the healthcare workers, and that really boosts morale. And there was a real sense of teamwork within the healthcare teams, from the general practitioners, the specialists, the nurses, the pharmacists, and at the primary care level, which is where we really focused, there was a lot of strategies that were implemented. One of them was to use this one profile of health professional that we call the primary care technical assistant. These people, what they do is they engage with the community and provide information, follow up on elderly who are living alone, and it really worked to lessen the burden on our healthcare workers at the hospital level.
Thank you. I'm going to ask Dr. Mokoke.
Thank you so much. I think it's so important, to remember that many of the health force, who are, of course, essential services workers around the world, are women, and that many of them already live in a world where their starting point is unequal. And so the inequalities that we see in the health care sector, of course, we realize that COVID-19 has shown us existing fault lines, that even at our best as a global community, we were not really prepared in terms of health systems planning and resources. And we saw this evident initially as the COVID-19 pandemic was quite dynamic and emerging a few months ago. The issues around personal protective equipment, not just only for the population and for other service workers, but even health workers themselves, who often had to risk their own lives to offer services. And we know, again, the continuing challenges around testing, kits, therapeutics, and treatments. Although I continue to observe excellence around the world and in some of the states globally regarding the response to COVID-19, it is important to reiterate the importance of using human rights standards in our planning and in our response. We know that the right of everyone to the highest attainable standard of health includes access to sexual and reproductive health. And in many countries, sexual and reproductive health rights have not been prioritized. Some resources have been shifted to other resources in the community. And yet we know that essential medicines, essential care around sexual and reproductive health rights are an integral part of health. The right to health is also interconnected to the right to dignity, information, the right to equality and bodily autonomy. And the healthcare workers are the ones who are at the front lines of ensuring that these human rights standards, that the policies and the laws that are enabling of citizens to access health are actually realized. And it's very important that at the moment across the world, frontline health workers are facing an unprecedented workload. Many of them are receiving no mental health support. And it's actually frightening for some of them to be working in these very stressful environments with little or no personal equipment, which puts them at heightened risk of COVID-19. It's also important to talk about the issues of healthcare funding and financing and the over-reliance on foreign aid and philanthropy for many developing countries for essential health services. And we saw initially when the lockdown and the freight and cargo transportation around the world slowed down, in many countries in Africa, there was reports of contraception stockouts. There was reports of people not being able to access safe abortion procedures and care. And although in a good way, we have seen an increased uptake in telemedicine and telehealth. And in South Africa, particularly, the Health Professions Council was able to relax some of the restrictions that were previously there. And doctors and as well as patients were able to use technology to increase access to information, but also to map patients to care. And I think it's very important as we imagine a world going forward to think strategically about the use of digital technology and interventions in healthcare for both the provider as well as the citizens and the communities around the world. Thank you.
Thank you. Dr. Jakob.
Dr. Kerry and dear panelists, first of all, let me thank France for hosting the Paris Peace Forum and acknowledge all the supporting institutions and extend my appreciation for the opportunity to participate in this distinguished panel. Back to the question, the global attention has indeed been unprecedented. We have all witnessed dramatic images of health workers at the forefront of the response. We have witnessed the public applause and the appreciation. In WHO, our attention has been focused on the COVID-19's impact on the health workers. And let me give you two examples. Firstly, the immediate impact on health workers and their safety. WHO has procured and shipped more than 186 million medical masks, 8 million face shields, 4 million guns, and almost 18 million gloves. WHO technical teams have produced more than 600 draft guidance documents with up to 9 million downloads per month. This is informing how governments, health systems, and health workers respond to the pandemic. WHO guidance includes the rights to health workers, the use of PPE, and also how to reduce the risk of infections. However, rates of COVID-19 infections among the health workers are still too high. Therefore, we are publishing new and updated guidance on infection control, and we hope that all countries will adhere to the standardized measurements and reporting requirements. The second issue I wanted to address is our attention on the burden and working conditions that health workers face. Many commentators talk about the first and the second wave of infections. We are concerned with the multiple waves of infections, the wave of the disrupted health services, the wave of mental health challenges, and the wave of long COVID. The combination of responding to the pandemic, maintaining essential health services, and preparing for a vaccine is overwhelming for the health workforce. We are concerned about the reports of increasing stress and burnout. And our latest workforce intelligence, which was updated just now before the World Health Assembly, identifies an increasing number of labor protests and strikes over 30 countries since February this year. Now that is a concern. These examples link to the second part of your question, what you refer to as the signs of hope for change. Let me give you one concrete example where we do see hope. This is the ACT accelerator and how we accelerate access to COVID-19 tools, including the potential of a vaccine in 2021. Just this week, one of the vaccine candidates reported interim results from large-scale trials. Never has vaccine research and development been so rapid. But vaccines don't deliver themselves. It is health workers who do. Dr. Kerry, you are a practicing physician from the US. Let's consider the guidance from the US Centers of Disease Control and Prevention on a future COVID-19 vaccination program in the US. The CDC suggests an adequate workforce is perhaps the most critical issue to focus on. That is the message we should all repeat. All countries should focus on workforce readiness, education, and learning. WHO will be driving this change, and we expect all countries, international financing institutions, global health initiatives, and all partners to get on board and invest in the health and healthcare workforce. Thank you. Back to you.
Thank you. You know, I think I'd love to ask some questions directed to our panelists. So, Dr. Soros, I'd love to ask you. Europe has been grappling with the loss of qualified medical staff really since the 1990s. What's driving this, and are there specific dynamics that could lead to solutions in Europe?
Thank you, Vanessa, for asking that question directly on the issue of European health workers and what I would call an existential crisis for the EU and its citizens, which is going to be the European Union will likely be judged by its citizens on how it handles COVID-19, and the issue of medical personnel between member states is going to be is becoming a fraught one. You've seen recently that the Czech Republic has asked for all of its doctors to return. Just to give you, the sort of brain drain or movement of medical personnel from east to west is one of the biggest wealth transfers in the history of the European Union, where essentially Eastern European and Southern European doctors are subsidized or provided a subsidized education to treat Western European patients. In Hungary, for example, in 2018, the last time we had statistics on this, 900 of the 1,200 doctors that graduated that year emigrated out of the country. There are obviously a lot of push factors in the countries, including corruption and the fact that a lot of doctors could earn more being cashiers at grocery stores. But I think it's important to understand how this affects the local population. Romania lost 1/3 of its doctors since it joined the European Union, and now 1 in 10 Romanians has an unintended health consequence, as opposed to 1 in 25, which is the European average. Most importantly, I think we are so used to Europe having this issue around immigration, but constant data is showing that Southern and Eastern Europeans are much more afraid of their own citizens leaving than real or even pretend migrants or even refugees coming. So I would like to applaud President von der Leyen's call for a European health union, but I think that this issue needs to be put front and center. Clotilde Armand, a French-born Romanian MEP, has called for a medical workers' compensation fund to go from west to east or north to south to help the local the sending countries' medical systems. We at the Open Society Foundations have worked with the Open Medical Institute in Austria, which has shown that in former Eastern Bloc countries, if you can increase the status of doctors and link them to the West, they're more likely actually to stay in the countries where they are. And we also see this as a great opportunity to integrate part of the non-integrated workforce, particularly women, in some Eastern and Southern European countries that have had barriers of entry into the medical workforce, and also for Europe's largest ethnic minority, the Roma. So these are a few solutions and dynamics that can help, but we are going to need more for anybody that cares about the future of the European project. Thank you.
Thank you very much for that. I mean, The dynamics in Europe, though, it's a global phenomenon, right? I mean, there's been a huge trend of brain drain and immigration into Europe of medical professionals being recruited from other parts of the world. And I think following up on that point, Dr. Mofokeng, I'd love to have you speak about the fact a little bit about how does some of the dynamics in Europe or some of the recruitment patterns that are happening or the need to fill some of the positions in Europe, and by the way, Australia, Canada, the United States also are recruiting heavily. They're the top 4 countries that take health professionals from less resourced areas. And just be curious if you would comment on how this reflects the larger dynamics in governance and what can be done about it.
It's so important because one of the areas of concern for me has been on ethical recruitment of healthcare professionals, particularly from developing countries to the higher income and the more developed countries. It's an issue that even as a young medical doctor and a young junior doctor, I've had to work with, because I was myself one of those people who were recruited and chose to stay in South Africa and work in the community here. But there is something to be said, I think, about the lack of planning and the lack of investment in the human resource in global health, because many of us are putting a lot of money into innovation and biomedical development and advancements, which is really important. But we seem to be lagging behind when it comes to real commitment to, firstly, personal development of the healthcare workforce, but also continued professional development. I wasn't taught human rights as an undergraduate doctor, and it's something that I learned as a medical intern and a community service worker. The fact that even in how I practiced medicine as a clinician could be in promotion and protection and also advancements of patients' human rights. And I think it's very important to also look at the undergraduate training of the healthcare workforce and everyone involved in the delivery of services so that they understand human rights, they understand how in their practice they can either enable a system where rights abuses happen, or they can look at their ethical standards and obligations and actually protect human rights of citizens. It's also, of course, important to remember that the resourcing around health systems, around it, of course, capital investment is good, but we have to understand that the acceptability and accessibility of care still depends on that human touch, one-on-one interaction. The quality of services still depends on healthcare workers who understand their responsibilities. And it becomes, of course, where we're already living in a world that the negative impact of situations such as disasters will disproportionately impact Black people, Indigenous peoples, people of color communities. It means that even those communities, even they tried their best, without the human resource, if nurses and doctors are being poached or being recruited in an unethical manner, those communities are even further going to experience difficulties, and the system is going to fracture even more, which is why it's more important to collaborate and strategize collectively to then have a vision for the world that we want to create, all of us, and then not work in silos. Because the other problem is that many a times, especially in global health, you have researchers, academics, lawmakers, legislators on the table, but you don't have the presence of clinicians. And we do need to change that because they are at the forefront and they understand firsthand the difficulties of translating all the investment and the policies into clinical care that's of quality service. But we do have to talk about ethical recruitment and fair labor practices.
Thank you. I think it's actually a big reason that I marry my work in public health and the work that I do with Steve Global Health with still being a practicing physician, because understanding that complexity of care delivery, the vulnerability of being ill of a patient informs the policy work that I do. So it is certainly the marriage of the two. I'd like to ask Ambassador Makaya-Hayes, who's really been helping to support and on the forefront of the COVID response, is what is the most important thing we can do for healthcare workers on the front lines, and what has been Costa Rica's efforts and the way the health system's been set up to support that?
Have to think strategically on where are the bottlenecks that exist in the system to support our healthcare workers, protect them, and make sure that they are not facing the dire experience of having to choose who gets a ventilator. So I think on the one side, it's a communication effort to get people on board that really this is everyone's responsibility, not just the healthcare workers. Second, we need resiliency and redundancy in the logistics of acquiring certain equipment. For example, all the personal protective equipment has been the Achilles heel in this pandemic, because everyone is buying the same materials at the same time from the same factories, and we're all sending planes to China. I mean, it's a real logistical challenge. So we need to think strategically, have some local production just in case of emergencies, and to have foresee the next healthcare crisis. And the next healthcare crisis could be something as sudden as a pandemic or as slow moving as the aging population. We certainly have to educate and train more healthcare workers. There's definitely an impending shortage of healthcare workers worldwide. This has been well reported on, and we need to form or educate that new generation of healthcare workers in order to ensure that we have enough people to take care of the rest of the people. We also need to implement the technologies, telemedicine especially, that allows healthcare workers to have an impact without exposing themselves or patients to the risk of contagion in a pandemic. One good thing that's going to come out of this pandemic is platform technologies that will allow us to have a quicker response in vaccine development and diagnostics. So whether it's sort of breathalyzer tests, saliva tests, and vaccines based on mRNA, these types of platform technologies will allow a much faster response the next time. And so that's something that's good that's coming out of this pandemic. One aspect of the Costa Rican healthcare system that has been critical in our response is the structure of the system. It's a universal coverage system that's all under one management. So all of our hospitals, clinics, primary care facilities in the public sector are under one roof. And this allows us to make decisions very quickly. We're a single payer, single provider system. So we can refurbish or reorient hospital services, rechannel patient flows without negotiations on who's going to pay for it or agreements between hospitals. And this has allowed us to respond very quickly. And here we are over 8 months since the first case hit, and we haven't saturated our hospital services. So it's a combination of a lot of things. But in the end, we all have to realize that healthcare is essential. It's not free. We have to cost it into the system, because when we don't have health, we don't have a country. We don't have an economy. And this is something that we have to plan for.
I could not agree with you more about the importance of really understanding the power of health, and COVID provides an extraordinary moment for us to really reconcile with that. When we look at how life has been disrupted, economy, there's been a whole series of stressors that have happened. And that brings me to Dr. Jacob and the WHO, which has really been the leading voice and has been, set up to be our global guide in many ways and accompanitor into how do we achieve that kind of health and the full state of it, the mental, the social, and the physical well-being, and that all-encompassing definition. And so as we talk about and have been exploring this really important power of investing in people in the healthcare workforce who are on the front lines, the WHO is in an ideal position to foster greater global cooperation on this particular pillar. And so how can, though, from your standpoint, how can WHO member states work together some of the collaboration that was already talked about to really develop their healthcare workforces rather than compete with one another? How do we create that kind of cohesion and sort of global collaboration to establish this? We have a critical shortage of 7.2 growing to 18 million, global health workers. How do we solve this?
Thank you very much, Dr. Kerry. Of course, member states are mindful of the challenge that you describe as the race to the bottom, and elsewhere it has been described as the global scramble of health workers. I believe the answers to this lie in the consensus that member states have reached on health workforce topics in the last few years. This includes the WHO Global Code of Practice for international recruitment of health personnel, as well as the Global Strategy on Human Resources for Health. Earlier today, in the World Health Assembly, where 190 plus member states come together to agree on issues in consensus, the World Health Assembly has adopted a decision to strengthen the implementation of the WHO Global Code of Practice for international recruitment. Member states indicated that health workers' migration is increasing in scale and complexity. Over a quarter of doctors, 1 in 8 nurses, and over a third of dentists and pharmacists are foreign trained. Since the COVID-19 pandemic started, there has been a further rush to meet the surge requirements and to fill domestic gaps through international recruitment. Regulatory measures have been enacted to make international recruitment easier. Countries are easing licensing and registration requirements and easing their visa processes. Some are offering priority pathways to citizenship for foreign health workers. Some countries are arranging special funds to recruit foreign health workers. In contrast, several low and lower middle-income countries have sought to place restrictions on emigration, refusing exit permits or certificates of good standing. Some countries have directly raised concerns to WHO, and we have acted on those, brokering negotiations to comply with the code's ethics and principles. So yes, there is a race and there is a scramble. However, this needs to be a race to the bottom. WHO is working to ensure that the code is implemented. We are advising countries on negotiating domestic policies and government-to-government agreements and adhere to the code. The UK spoke of their work this morning, updating their domestic code with WHO's engagement. Similarly, we have been supporting Germany in their policy approach. These negotiations ensure that support and safeguards are in place. Now that the Assembly has agreed on a course of action, we will be expanding this work. Also this morning, the Assembly agreed to designate 2021 as the International Year of Health and Care Workers. This is an opportunity to revisit the underlying cooperation between countries, between the health, education, finance, and labor ministries. It is also an opportunity to revisit cooperation across countries and regions. I'd like to invite you, dear panelists, Alex, Tlalen, Manon, yourself, Dr. Kerry, to work with us on the International Year. I invite you to help us progress on the support and safeguards. Help us progress on the rights of migrant health and healthcare workers, the majority of whom are women and often in precarious employment. Help WHO to ensure the International Year of Health and Care Workers in 2021 is the beginning of a race not to the bottom, but to deliver on the Sustainable Development Goals. Thank you, and back to you.
Thank you. I mean, I think that you have the commitment to see global health. This is what we do. You know, everything that we're doing is about investing in the current generation and the next generation of a healthcare workforce that can be responsive, can be supported, can be trained and empowered to do their work with the skills they need to bridge that quality gap. But I think the question that I want to ask all the panelists as we get to the end of this session, we have 5 minutes left, but I'd love to hear from you, if you want to raise your hand, you know, how do we get member states with all the competing problems, though, that they have? Every nation is struggling to manage this urgency to figure out their defense, their education, their spending. How is it, for example, if I start with you, Ambassador, that Costa Rica prioritized, for example, a universal healthcare system and really empowering the healthcare workforce? How do we make this investment in people, which feels like it takes time? How do we make that urgent and something that governments are willing and private sector are willing to invest in, be patient for, and support? Any takers?
So I'll speak on the COVID-19 vaccine. I think we have an opportunity as a global community to really reaffirm our commitment to each other as citizens of this world. And I think it's important to realize again that, you know, countries maybe, you know, going ahead to strike deals and hold some of these vaccines for their own population instead of engaging in a coordinated global effort to share them across borders. It's important to remind them that, unfortunately, they won't achieve the intended purpose. We are not safe until all of us are safe. And I think it's important, again, that the healthcare workers who continuously, day after day, go out there to expose themselves, right? They're under occupational health hazard of COVID-19. They need to be prioritized too as recipients of these doses of vaccine, because they are literally risking their lives for all of us every single day. And it is important to talk about, you know, fair remuneration of healthcare providers in the public health sector and move from applause to action. We all remember how everyone used to clap hands at 7 o'clock in the evening. But health workers need us to move from just applaud to real action. And when it comes to the vaccine particularly, it's important that we have equitable access and that we really all of us support a human rights approach and an intersectional approach and really leave no one behind and be intentional about looking at those who are in vulnerable situations.
Thank you. We have 1 more minute if someone else would like. Yes, please, Ambassador.
I think just recognizing the tremendous cost this has taken on the economy, on the global economy, on health and so forth, is something we can't forget. And when we think about the cost of training the next generation of healthcare workers or investing in the infrastructure that we need, compared to the trillions of dollars that this pandemic is costing us worldwide, it's a drop in the bucket. And we need to put that in perspective.
No, I very much appreciate that. You've 30 seconds, Dr. Jacob.
Well, we have an unprecedented research and development ongoing to develop all these tools against the COVID. And also to ensure we have a good consensus to ensure equitable distribution and fair allocation. And we are now rolling it out to the member states and work with the member states to make sure that there are no gaps and bottlenecks in the way to deliver these vaccines. And healthcare workers for this will be at the center. And for all this, we need political commitment. Without political commitment, this will not happen. And what I can see is that with the COVID, the political commitment has increased. There have been very visible actions in the forefront. political commitment has increased not only towards universal health coverage and financial protection, but also to protect the healthcare workers. And that will also help us to invest more into the health system and in building back as we move forward.
And I think that's exactly what we hope for, because our security is our health, and our health becomes our personal, individual, community, and national security. So with that, I want to thank our panelists for joining us today, for your extraordinary comments, contributions, and for the work that you are doing every day. And I invite this audience to help us continue it. Thank you.
Thank you. Thank you to